morning again. Here we go. We're going to be talking about today, we're going to talk about thiamine. And again, thiamine is kind of a near and dear drug again because you're going to learn that it's what helps us metabolize glucose. So again, thiamine again is basically one of the B vitamins. So it's a very, again, it's part of our nutrient complexes, vitamin B12 to be exact. Again, so it's again the classification of the drug again is a vitamin substance, a vitamin replacement, and it is essential for the normal breakdown of glucose. Without it, we can't have that glucose breakdown. It goes into that citric acid cycle. It helps that cycle go, but without it, we cannot metabolize glucose correctly. Okay, so it has a big deal in that citric acid cycle. So again, it's usually less than 1 minute is onset, and then how long it lasts kind of depends on how much B12 is in there. So again, it's dependent on the degree of deficiency that the patient might actually have. So we use it when we give D50, and we probably should give this before we give D50 or D10 or any time that we're giving a sugar replacement. And the reason that we give it is, again, so it can help process that glucose that we're putting into the system. So, again, it's used when we have a malnourished patient and emaciated patient. If they're a known alcoholic, we use this to prevent what's called Wernicke syndrome. Again, and then chronic alcohol use it interferes with the absorption of and the use of the B12 vitamin. So, again, usually it's fasting neurological symptoms, and again prevents that Wernicke's encephalopathy, which is basically essentially brain swelling, and again can cause seizures after you give D50. So we don't want to complicate things. Actually, this is a pretty safe drug to give. If you give it in a really big dose and really fast, you can drop the blood pressure. So be careful. And then they might get a little nauseous on you. But again, it can also cause a little bit of pulmonary edema. But that's usually because we gave it too fast. So give this drug nice and slow. So again, if they have a known sensitivity, that's when we would not give it. But again, pretty safe drug as far as there's no real contraindications to it. And again, you got to give thiamine before the glucose in all circumstances. And again, and that's so that it can help process the glucose. And it's kind of funny because a lot of times we'll see the medics just push the D50. They won't give any thiamine behind it. And again, if you give the thiamine a little bit earlier, they come out of it a lot easier, a lot faster. Again, we usually give 100 milligrams. And by the way, the preparations that we usually use in EMS, it says 1,000 milligrams in a 10 milliliter vial. We usually have 200 milligrams in a 2 milliliter vial. So one of the biggest problems is the person draws up all 200 of it. So double check your dose when you're given the thiamine. You only want to give 100 milligrams and give it nice and slow. And again, for pediatrics, we just don't give it. It's the pre-hospital use. So again, we give this IV, IOIM, and again, that you might see that a little bit later. So be careful with that. And again, pregnancy category is a category A. It's again a very safe drug. So that's the recap on the thiamine. And if you got any questions for that, just let me know. And good luck on your test.